So you have a new baby. The first few weeks are just an incredible mix of joy and wonder, right? But let's be honest, they can also be filled with some serious challenges. There is so much information out there, it can feel totally overwhelming. So the goal here is to cut through all that noise and give you some clear, reassuring guidance on the things new parents often face. Okay, let's just dive right in. Right off the bat, let's get this out in the open. If you are finding breastfeeding to be difficult, you are absolutely not alone. This quote is so important because it just normalizes the whole struggle. It really is a learning process for both you and your baby, and hitting a few bumps along the way is completely 100% normal. All right, to build a strong foundation for breastfeeding, we're going to break it down into 3 core ideas. If you can get a handle on these, it can make a world of difference. We're talking about positioning, the letdown reflex, and the whole concept of supply and demand. First step is positioning. You can think of this like setting the stage for success. Before you even think about the latch, the question is, are you both comfortable? The real key here is alignment. You want your baby's whole body turned in towards you, kind of chest to chest, with their mouth right there level with your nipple. This means they don't have to turn their head to eat, which makes swallowing so much easier for them. Okay, now for the main event, the latch. It's kind of like a dance you're both learning for the first time. You lead by just tickling their lips until you see that big, wide-open mouth, like a yawn. That's your signal. Then, bring the baby to you, not the other way around. Now, pay close attention to this next part. You want them to get a big mouthful of the breast, not just the nipple. And the most important rule of all, if it hurts, it's not right. Seriously, don't try to power through the pain. Just gently slide your finger in to break the suction and start over. Next up is something called the letdown reflex. This is your body's automatic response that gets the milk flowing. For some people, it feels like a distinct pins and needles sensation, but for others, they feel nothing at all, and both are totally normal. But here's the thing you need to know. This reflex can actually slow down if you're stressed, anxious, or in pain. And that's exactly why creating a calm, supportive space for yourself, especially in those early days, is so helpful. And this brings us to the absolute magic of supply and demand. Your body is incredibly smart. The more milk your baby takes out, the louder the signal your body gets to make more. And who's in charge of this whole process? Your baby. When they need to ramp up your supply, they'll just naturally want to feed more often for a day or two. So, you gotta trust your baby and trust your body. They know what they're doing. Okay, so you get the fundamentals. But what happens when things still feel a little off? Let's move on and talk about how to troubleshoot some of the most common feeding challenges. And remember, these are just hurdles. They are not dead ends. This has to be the #1 worry for new parents. Is my baby getting enough to eat? Studies show that a lot of mothers actually stop breastfeeding because they think their supply is low, when in reality, most of us tend to underestimate how much milk our bodies are actually making. So, how can you tell if there might be a genuine issue? Well, here are some concrete signs to look for. Now, a baby demanding frequent feeds on its own isn't necessarily a problem. That happens a lot during growth spurts. But if you see that, combined with these other signs, especially a drop in the number of wet diapers or slow weight gain, that's your cue to check in with a doctor or a lactation consultant. If you do need to boost your supply, the key is really leaning into that supply and demand system. Feed your baby often, especially at night when those milk-producing hormones are at their highest. Expressing milk after a feed also sends a really powerful make more message to your body. And you can't pour from an empty cup. Getting enough rest, food, and water is absolutely essential for you too. All right, now let's flip the script and talk about the opposite problem, engorgement. This is when your milk comes in so fast that your breasts get uncomfortably full. We're talking swollen, hard, and really sore. It can even make it tough for the baby to latch, which just creates this really frustrating cycle. So what do? Well, the best treatment for engorgement is, you guessed it, regular and effective feeding. Let that baby eat on demand. A warm compress before a feed can help get things flowing, and a cold pack afterward can bring down the swelling. And if you feel any lumps, just gently massage them toward the nipple while the baby is feeding. That can really help clear things out. Oof, this is another common one, and it can be really painful. But here's the most important thing to know about this. Sore or cracked nipples are almost always caused by an incorrect latch. And that means it is not something you just have to suffer through. It's preventable and it's fixable. To get them to heal, you have to fix the root cause, which is the latch. So go right back to those fundamentals we talked about earlier. Changing up your feeding positions can also help, since it changes where the pressure is.
And, a great little tip, always break the section with your finger before taking the baby off the breast. Never just pull them off. The really good news is that once you get a proper latch, things usually heal up in just a day or two.
Okay, now we need to talk about something a little more serious, and that's mastitis. This isn't just discomfort, it's an actual inflammation of the breast tissue. It can become an infection, and it's usually caused by a blocked milk duct that didn't get cleared. This is something that requires prompt medical attention. The symptoms of mastitis are pretty distinct. You'll likely see a red, tender, sometimes wedge-shaped area on your breast. But the real giveaway, the thing that sets it apart, is that you'll also feel sick. We're talking feverish, achy, just completely run down, almost like you've got the flu. If you feel this, you need to call your doctor right away. So what do? There's a golden rule. Heat and drain the breasts. Now, alongside any treatment your doctor gives you, like antibiotics, the single most important thing you can do is keep draining that breast. Apply some heat before you feed, and keep breastfeeding, starting on the affected side even though it's sore. It is perfectly safe for the baby, and it is the fastest way to clear that blockage and start healing. You know, the challenges of becoming a parent aren't always about what happens after the baby arrives. For so many people, the journey itself can take an unexpected and truly heartbreaking turn. And we need to talk about this, because it's a silent difficulty that far too many people experience all alone. So let's talk about miscarriage. It's a painful and deeply personal experience, but it's such an essential part of any real guide to parenthood. We believe that providing clear, honest information is one of the most important ways we can offer support and understanding. Let's start with this number. About 1 in 4 known pregnancies ends in miscarriage. Just let that sink in for a second. This is not some rare event. And the reason this number matters so much is to fight back against those deep feelings of isolation that so often come with this kind of loss. If this has been your experience, please know you are so far from being alone. So, what exactly is a miscarriage from a medical standpoint? Well, it's defined as the loss of a pregnancy before the 20th week. It happens when, for reasons that are almost never in anyone's control, the pregnancy just isn't able to continue developing. The experience can also be different depending on the type. A threatened miscarriage is when there's bleeding but the pregnancy might still continue. An incomplete miscarriage means the process has started but some tissue is still left in the uterus. And a complete miscarriage is when all the pregnancy tissue has passed. Just understanding these terms can sometimes help make sense of what a doctor might be telling you during a very difficult time. Whether you're dealing with feeding challenges or you're grieving a loss, the path forward really requires both physical and emotional healing. So let's talk about what is maybe the most important part of that journey. We want to end on what is the single most important message in all of the research. For anyone who has ever experienced this kind of loss, please hear this. It was nothing that you did wrong, and so you should not feel any sense of blame or any sense of guilt. A miscarriage is most often simply nature's way of dealing with a pregnancy that wasn't developing correctly. It is not your fault. So, we're going to leave you with this question. We know that these struggles, everything from breastfeeding to pregnancy loss, are incredibly common, yet so many people feel so isolated in them. So how can we, as friends, as family, as a society, get better at talking about these things openly and creating communities that truly support new parents through all of it?